Well, welcome everybody. It's another great Tuesday in the neighborhood. How you doing back there, John?
Doing well, doing well.
So today, I'm lucky to get Sam back on the show today, and he brought with him Mr. Scott Masi from Brighton Center for Recovery. They have an event coming up with a famous comedian, what I was told. Of course, I forgot his name.
Mark Lundholm.
Mark, I'm sorry, Mark. Usually I'm more prepared, This is just a fluke. But anyways, we're going to do this a little reverse today. Normally I will talk to my guest before I bring the person on, but since Mark doesn't have a lot of time, I want to bring you in now, Mark, and you can tell us about the event and how you are connected with Sam and Scott. So are you on the phone?
Well, yeah. Happy after holidays to everybody here.
Yeah, same to you.
I am joyfully included in a process that is about education and prevention for the community as far as drug and alcohol stuff goes, addiction, incarceration, and some of the consequences that go along with some really poor choices that seemed like a good idea at the time to some of us. Normal people, not so much, Normal people, meaning most. Most people don't let a tool turn into a weapon. The rest of us, it's weaponry, and that's all that we're interested in. And so this comedy show on Saturday night and some of the other visits that I'll do during the week, jail and high school and some private stuff, lead up to a big Saturday night show that has a lot to do with healthy comedy. I call it PG-35 on Saturday night.
So that's different than 13.
Which means anybody can go to it. I mean, if it was up to me, you could bring a 12-year-old. That's fine. They won't hear anything that they haven't heard before, especially at your house if you're coming. But the joke there is PG-35, which means I won't curse, but you'll think I did.
Yeah, I was getting ready to say that's got to be something off the chain if it's 35.
It's older references. I mean, if you never saw the Brady Bunch in its original showing, there's a couple references you won't get.
Yeah, I remember them. Some people, they don't know what that is. They're not old enough yet.
I do that when I date now. She has to be old enough to recognize the phrase, one Adam 12, one Adam 12, be the man.
I know it well. You probably couldn't pop off one that I don't know.
No, and you know what? If she's too young to figure that out, I have to ask for her mother's phone number.
Oh, snap. You better ask for ID, too, because we wouldn't want to have to get you out of jail.
That's true. So the show is very human. It's funny. Sam has a great passion for healing, and Scott Masi, I know, is a big apostle for just getting the word out that there's a place to go for help. The Brighton Center helps more people than I probably come across in a year, and I travel significantly, so I know what kind of effect they have on the community, and I'm glad to go to work for them. It's a great show. I got a lot of help. And I love the community. I was introduced to them a couple of years ago, actually, and I'm really looking forward to coming back.
Yeah, I have a little bio of you, and it seemed like you've been around the block a couple times.
And back. What'd you call me?
That's right.
Maybe a couple?
Yeah, I mean, I'm looking at stuff up here, and I'm going, dang!
Depends on which block.
Yeah.
Some I try to avoid now.
Oh, right. These on this list, I think you love those blocks because you've been around them a few times.
Yeah, I was born and raised in Oakland, California, and so it was a harder area back then in the '60s, but not as violent. It was hard because it was poor.
Right, but now it's violent and poor.
Yeah, and you know what, back then, and this is a joke alert coming, I want to soften the blow here a little bit because I think that comedy allows us to be less threatened by a topic and a little safer to approach. I'm not taking it lightly, the disease or any of that, but I do know that I can talk about trauma if I don't give it so much power, and comedy takes the power out of a lot of this. So the joke is that back in the '60s, growing up in Oakland, we had rules. We didn't steal from people on our own street. We went out of town for that.
Oh. They should do that more now because they be hitting their next door neighbor and then smiling in your face.
They'll go upstairs and steal from Granny when she's sleeping.
Exactly. You know that commercial about who's doing your drugs? You open up the medicine cabinet and the little girl is doing the drugs the same time as granddad, and they come and watch your drugs.
That's right. That prescription, whatever's on that prescription, it's just the last name I care about. That's mine.
So how did you get involved with Sam and Scott?
I think I probably met Scott through a conference level where I do some professionals presentations. I will talk to a group of clinicians, interventionists, drug counselors, and I'm pretty sure I was introduced to Scott through that. He probably came to a show and then talked to me afterwards about coming to his place. He's a passionate guy. He doesn't give up. Scott's a pit bull when it comes to getting what he wants. And Sam I was introduced to last year because he has such a powerful presentation to the youth. I watched him talk to some people at the high school there that I worked for. And it was just, we all want the same thing. We all want some of this pain and the death that follows to start dissipating, and for people to get the idea that, this is a serious disease that has very little to do with actual moral choice. It has more to do with genetics and history of your family than anything else. So
I didn't know that.
We all go that way. I mean, the three of us, I'm sure. It's in our DNA, and a lot of people, and that's not Mark's opinion, that's a medical fact, that we're born with a disease that says, I want more even when it's terrible, because I understand how to be the victim, and I'm comfortable with losing everything. And if you're my friend, I'm going to take yours too.
That's a powerful statement. I never heard it quite put like that.
Well, I write for a living. Thank you.
What do you write?
I write comedy. I write stories. I write for people that you do know fairly well. Comedy is a strength of mine, but I developed that through a dysfunctional upbringing where if you weren't funny, you didn't get to talk. Because if you wanted to talk about something serious, you got more of it real quick. You just didn't bring it up. My house was fairly violent and aggressive growing up, and you didn't talk about that part. So you just made it funny, and it was false.
Right.
That funny was false early on, but now it has a lot more to do with faith and footwork than it does with phony. The humor. So it's a maturity process. I'm 54. I act like I'm about 18 most of the time.
Well, if this must be somebody else's picture that I'm looking at.
Well, say alcohol is a preservative.
Well, I mean, you look about as young as me, and I'm 60, so I guess we doing. Can you see me now?
What are you doing this weekend?
Hey, I'm being preserved with you.
I can't wait to get to Michigan, and I know that the weather's not as friendly as it is here in California this morning. But I got to tell you that it's as warm as any place I've been when I get to the Brighton place and the people I'm going to be visiting, and I know that the community there is really interested in this. So I appreciate you paying attention to this event, because it's. I was there last year. It was a fun show. I have a bunch of new material for them to see, even if they were there last year. This year's a different show, and because I think we're different people a year later. Yeah,
I'm a year older, anyways.
Well, I'll take that. I'll take your word for that. But I tell you what, I also know that as we get older, it seems like time passes faster until you have to wait for a kid somewhere.
Yeah.
I got a 6-year-old, and when I'm with him, time just drags by sometimes, and it's beautiful because he doesn't know what time it is. He doesn't really care what time it is. I got him ready for school this morning, and he didn't care. He didn't care that it takes longer to put his shoes on today than it seemed like it did yesterday because I'm in a hurry.
Right. Well, at your age, he gonna be helping you pretty soon.
Well, you know what? I'm counting on it. I like to tell people that he and I are growing up together.
Yeah, that's your little brother, actually.
Yeah, someday, some days he's a little more mature than I am, and he reminds me of that. But I don't complain, not very often. If I do, it's a Cadillac complaint, a platinum problem.
Yeah.
I have I have a 6-year-old boy who has a lens to look at life that's godlike.
Mm-hmm.
He's very pure, and I don't want to mess that up. So,
right.
I let him smell my coffee, but he's not allowed to drink it yet.
Oh, so that. Well, when I was younger, my grandmother told me I could drink some, but I didn't like it, so she did good. I only had to try it once. Plus, coffee makes you black, and I just can't take it.
For him, coffee is like cocaine for me. Mm-hmm. I just like the smell. Thank you very much.
Well, I want to thank you, Mark, for taking your 15 minutes of time to spend with me today.
I'm grateful to you. I wish we had more. I really appreciate the time you spent. I like your energy, and I hope that the show is really good.
Well, I'm always good. Tell them, Sam.
Oh, definitely.
Definitely. Yeah. And plus, I got my pit bull over here to get my back, so...
That's right. You know what? When Scott wants something, he calls you like you owe him money.
It's that hitman mentality.
Oh my God, it's amazing. Yeah, without all the hurt and the pain.
Right. I don't want the hurt and the pain.
Good stuff. Listen, I hope you guys have a fantastic day. I'll see you this week, and I can't wait.
Yep.
All right then, Mark. Thank you for taking some time and spending with us today.
Thank you so much.
Thanks so much, Mark.
See you soon, Mark.
Okay.
Bye-bye. Oh my goodness, I had my laugh for the day. So now you guys tell me about this event. It's called Laugh is No Luxury. And is that what your group is putting on this weekend? Both of you together?
Yeah, well, basically, my role at Brighton Center for Recovery is as an outreach specialist, so I'm in the community all the time. Mm-hmm. And I had gotten involved with Sam in Chasing the Dragon. Mm-hmm. What's it been? I mean, time just flies. It's over 2 years.
Yes.
And when I met Sam, I mean, it was right after the loss of his daughter, and the community was really, Sam and the community were really reeling from what had happened, just being part of the group there and watching us develop and really taking initiative in the community, and through that, you just continue to get the message out any way you can. Mm-hmm. And Mark, I've been associated with Mark for a while. We use his material in our groups at the center. We are an inpatient facility that sees over 100 patients, and at one time, we have 100 beds. We see well over 4,000 patients in an inpatient setting a year. Mm-hmm. So his message is just, it's just so great for the patients to hear, because, I mean, they're reeling, they're really in a place in their life where humor needs to be brought in, and they need to look at the issues they're facing with their addiction in a different light.
Right.
So Mark does a great job of bringing that, and then with the community involvement and that we want to do is bring awareness and bring the barriers down, for the association with addiction. We go out into the community. And working with Chasing the Dragon and the community parent out of Fenton, we're able to put together these events, and it's always an initiative to me. It's not a Brighton thing. Mm-hmm. It's a community thing. It's trying to build as many collaborations as you can.
So now, do you do anything with Genesee County, or are you strictly Brighton?
Oh, no. Well, Brighton. Going back, Brighton is the oldest treatment facility in the nation. We go back to the founding of Bill Wilson and the founders of AA. Mm-hmm. Had their hands in the development of Brighton.
Oh,
so we go way back. Mm-hmm. So we've been in the community, but it's working throughout Genesee County, throughout Wayne County, Livingston County, Oakland County. We're throughout Southeast Michigan and Michigan itself. Mm-hmm. So it's building the relationships with all the community partners that are out there. It's just so important to have a voice that's you can reach so many different people, because what we're seeing right now with this issue, it's not going to get any better soon.
No, it's getting worse.
Yeah. He's a big member too of Community Parent. Him and we've got Scott, and we've got the Odyssey House from the Genesee County, which they help out when we go into schools, if somebody comes forward and they're looking for a treatment center, that's where Scott would come in,
Okay.
Or somebody from the Odyssey House.
Mm-hmm.
So they play a major role, because when we go into schools, we hit them head on. This is reality.
Right.
This is what's happening.
Mm-hmm.
And every now and then we get young kids that say, I'm in trouble.
Right.
Or, my parents
Mm-hmm.
are this or whatever. So they play a major role.
Now, do you have people that actual like drug addicts that when you go to the schools that come in and talk, like people say like him that's been through it, come out the other side to help you?
Yes, we
like
do.
say this is the face of an addict per se.
We have a good friend of ours that speaks. His name is Alvon. Alvon was a drug dealer, did drugs, been shot at.
That's the kind of stuff they need to see.
Bullet
holes.
Spent a lot of times in jail and prison, and he ended up going to school. Now, Alvon, not only does he speak for community parent with Chasing the Dragon, but he goes into prisons, and talks to at the Genesee County Jail and stuff like that too.
Mm-hmm.
So, plus we, we have one speaker. He was like in the MMA.
Wow.
And he got hurt, and from being hurt, he
got addicted to pain pills.
Got addicted to pain pills, and from the pain pills, it ended up being, the crack and heroin. So
it seems like that's easy to switch over to, because when they start taking the pain pills, after a while, it doesn't help anymore. And then next thing you know, they got meth. I mean, that's a big jump. I mean,
you bring up a great point, Lisa, because prescription medication it's exponential. What's happening, the availability, the ignorance to the use of it, and the doctors that are prescribing aren't doing a good job from the front end of assessing the people that they're prescribing it to. So, just from a standpoint of what we're seeing in treatment facilities, the 18 to 25-year-old population is almost half of our population, and it's all heroin, and it's all gotten to that point from. Over 90% of it is through the Vicodin and the OxyContin. Yeah. And I can tell you, I speak from a standpoint, I am an ex-addict myself. So, that brings, a deeper perspective, when I'm dealing with a lot of, the people that are struggling to get into treatment.
Yeah.
And now with the new environment related to healthcare, it's getting tougher and tougher because of the out-of-pocket costs. But Genesee County, all the Tri-County programs, there are some great community advocacy for people to find what they need, and it's just getting them to make that call.
Yeah, and I always find it interesting to talk to someone that, like you say, you were an addict, and now you counselor or whatever your title is like that, and when you say. You could actually go in there and tell the people this is how it used to be versus someone that just have the book knowledge. You go to school for 4 years and you've never experienced anything. So do you think like you would be a better person, say if I was an addict, to come and talk to versus someone who's never experienced it?
Well, I think we all bring something to the table. I work with some, just some fantastic therapists and counselors and doctors, even the doctors that we have on staff who are addictionologists. Now, granted that, they might not have come from, their own pattern of abuse, but, They understand it. They have that compassion. They have that that angle that they come from. And now it's so prevalent in our society that everybody's affected. Yeah. Everybody has somebody in their family that's affected. There's 25 million people in active recovery in this country. That's 10% of our population.
25 million?
25 million, okay. And
now who counts all these?
Yeah, I know. Yeah, exactly.
That's a high number.
Yeah, you're right. And then you take that even one step further, and you say of those 25 million, they're engaged in families,
right?
And then it's exponential for the people. Like when we go into the schools, and when Sam speaks, and then after, we're what we call a debrief. We go into their rooms and we talk to them. We want to know what they heard and how they're feeling, because it's a very, very graphic, and it's a hard-hitting presentation, and it opens up a lot of wounds. It opens up. They might not be using, but they might be living in an environment and in a dynamic where there's use.
Yeah, because I watch Intervention. I love that show. Okay. And it makes me cry a lot because some of the people are so strung out. Either they're on meth, they're on heroin. One guy was such an alcoholic that he was drinking liquid soap because it had a percentage of alcohol in it, and he was mixing it with water like a shake. And as he drinking it, talking about, it's not that bad.
Well, you know, it's funny you bring that up, Lesa. I just had to pick someone up, and this is a. You know, it's in the community, and there's a hotel which is close to the facility where a lot of these guys work. Well, they've lost their license, they can't drive, so they've lost their family. They're living in motels trying to keep their job. Right. And it's fun. I say funny, but it's not funny. But I went in to pick up one of the guys, and there must have been about 50 of these vanilla extract bottles in there. And that's, you know, sometimes, whatever it takes. It's just, and it's a vicious cycle. And what we try to do is we try to teach people about the disease concept, that this is a disease. It's like any other chronic illness, like diabetes, hypertension, you know, even cancer. This is something you're going to deal with for the rest of your life. I know I have to deal with it for the rest of my life, so I have to be able to assess what's going on in my life and if I can handle it properly. And it's, you know, I'm not obsessing about, you know, some of the thoughts that took me to the places they took me before. So it's just trying to you know, teach people a new type of lifestyle. Yeah.
And I know you had gone through the same kind of thing, like it's in your family and things like you didn't even know that was going on, and then once you find out, it's like,
Lesa, it's you know, for every person that we lose that you hear about, there's hundreds that have gone, and we didn't know why they died.
Right.
You know, I was listening to CNN. Dr. Gupta was talking about, you know, he says every 19 minutes somebody dies of an overdose from drugs and alcohol.
Every 19 minutes.
We lose more people to drugs than we do in wars.
Exactly.
You know?
And then some of the people come back from the war and they get strung out again.
And you bring up another great point. I mean, you know, I go throughout the community, and my presentation is on emerging trends of abuse. And what we're seeing it's with the VA, with the veterans that are coming back. What is happening is they're being introduced to these opiates. They're being introduced to benzodiazepines like Xanax to deal with their depression. They're dealing with depression and pain. They're dealing with post-traumatic stress. And the prescribing patterns, we are in an area we've never, as a society, been in before.
Let me give you a pill for everything.
Yeah, let me give you a pill for the pill.
Yeah,
I mean,
exactly.
But it's so obnoxious. But let me give you some stats. The U.S. makes up 4.6% of the world's population. We consume well over 90% of the world's opiates. Wow. 90% of the world's opiates. Now, I mean, are we any different in our human structure that we can't deal with pain like another society?
Right. I mean, everybody should be a junkie when you say it like that. I mean, we all should be tripped out on something because it's just. And I said, you know, always said they give you pills for everything because all the kids now with attention deficit. When I was growing up, I'm pretty sure we all had it, but nobody had pills for it. I mean, you dealt with it, and now it's like, oh well, they can't sit still. Give them a pill. You know, to me, that's just crazy.
You know, after Brianna passed, for a few months, I was in a world of depression, and my wife, she says, "Honey, please go talk to somebody." You know, so I did. You know, and I'm a veteran, so I went to the Veterans Administration, and I talked to a therapist, and she says, "You know, Sam, you need to get at least something to help you sleep." I said, "Okay." So a month later, I got to see a psychiatrist or whoever writes a prescription. And he starts me out with supposedly a low dosage to help me sleep. So the following month, I come back and he says, "How you sleeping?" I said, "I'm still, you know." well, let's kick it up a
Kick it
notch,
up.
Now we're up to 2 pills.
Mm-hmm.
So the following months I come back and he says, how you sleeping? I said, I'm still waking up and now I'm real groggy in the morning. He says, all right, well, now we're, instead of 2 different medications, we're up to 4.
Oh.
So within like 4 months, I come back and I see him and he starts talking and now he's thinking he wants to give me something else.
He want to give you something to counteract those pills.
Exactly. And he says, well, how's this? I says, you know what? No disrespect. I says, but I'm depressed.
Right.
I lost my daughter.
Right.
Maybe I just need to feel.
Yeah. He want to put you to sleep.
Exactly. Maybe I just need to feel. He says, well, he looked at me, and he's like, I don't know why you came to see me. I says, I don't know
either, but you just took half of my money.
I stood up. I looked at him. I says, I know I'm not coming back, though.
See, they so quick to pull out that prescription pad. Like that's the answer to every problem. And so many people fall into it that their kids get, you're sitting in school, you can't concentrate because you're sleepy. Now there's another problem. First you can't sit still, now you too still.
To be honest with you, Lesa, with Brianna, it was like she's got ADD, she's ADHD, and I kept avoiding the prescription stuff.
Right.
And then finally, they said she's bipolar, and that's how it started with her too.
Yeah.
And it was like, here, a pill for this, and a couple more, and and I told her this one day. I says, I don't know what the difference is between these or the street meds.
Right. Except the price when they're getting paid for it. But my thing is, this bipolar thing I think is getting out of hand now.
Well, let me tell you. I'm sorry to cut you off, but when you start talking about bipolar, I get really, I get a little upset because when you start looking at the SSI rolls, Social Security or disability rolls for kids under the age of 18 in this country, it's a straight line that since 1987 it didn't exist. We have well over 2 million kids under the age of 18 that are categorized as disabled because of bipolar or some other mental illness, and are on medication. And they're on the rolls of of the federal funds and that.
You can get SSI,
right?
And sometimes they use that money to go get drugs.
Yeah. So that the whole medication piece is, this all started pretty much back in about 1990 when the American Medical Association, the AMA, decided, well, we're not treating pain properly, And
who's to say?
Yeah, and they just start the prescriptions, that are written in this country. Right now, well over 40% of the prescriptions that are written in the state of Michigan are for opiates.
And you get addicted to them. I can't even take Vicodin. It makes me itch.
No.
They have to give me something mild. I'm a panty weight. I can't take any of that.
Yeah.
And plus, I'm afraid of it. I'm afraid seeing how many people get addicted to stuff like that, Percocet, and then when they get them, they start selling the tablets.
Yeah. Well, now you're talking about the price of this stuff. You look at the price of gold is roughly. I think. Last time I looked, it's about $1,500 an ounce. An ounce of OxyContin on the street is roughly about $12,000. So
it's worth more than gold.
I'm sorry I have to bring that up, but that's I kind of equate it to
right.
It's ridiculous. And going back to the things related to ADHD. There is a big push. I have my child. I have two beautiful daughters. They're 9 and 12, and they had witnessed back, when they were in first grade, a pretty traumatic divorce that their mother and I went through. And then they were relocated. They're in a new school. And within the first week, I had a first grade teacher approach me and tell me my child needed to be on a medication. First of all, you don't know who you're talking to,
right?
And I can understand you're having an issue because your classroom size is a little high,
right?
And this is your way of looking at things. We did an evaluation. There was some behavioral issues, but it was situational,
right?
and she grew out of them. And that's the thing. Parents need to kind of investigate, take a little bit of responsibility to go that little extra mile.
Because the teachers don't. They will tell you they only have to teach a certain curriculum, and that's it.
Yeah.
If you want them to go the extra step, then you got to go in there like gangbusters and threaten them and everything in order for them to do anything. I was so glad when my son got out of school because he's special needs and he was diagnosed at an early age, and I had to go in there and fight for him to get a decent education. When they see me coming, they be like, "Oh, here comes Queen," because we went through a messy divorce too and all that too, and he got to see all that craziness. But I had to be the one to take care of that because there was nobody else, fighting for him in school. They was just like, "Well, we only have to teach so much," and I was like, "Well, what much is that?" I don't play with that. It's like,
in the dynamics that these kids are growing up in, they spend that much time. They're spending the majority of their time in school. They're starting to develop peer relationships, and that's, I think, one of the strong things that in Sam's presentation and in the Chasing the Dragon presentation is we really push for the kids that we talk to make good peer choices, because that's where they're getting all their information. That's where they're developing a lot of the characteristics that they're going to carry on in life. And just the compounded issue to what's going on at this age. You're talking junior high, high school, or I should say middle school.
Yeah, they don't have junior high anymore.
Is that you look right now. We're working on a program called Mobilizing Michigan, and it's addressing the marijuana issue.
The medical marijuana.
Medical marijuana, even recreational use. I mean, you have two states now, Washington and Colorado, that have recreational use. Now, I have to be careful here to say, it's pretty much the writing's on the wall. We're going to be to a place eventually, a few years down, where the legalization is going to be there, but it has to do with where our kids are now. They're going to be voters eventually, and if we don't get to them and kind of educate them, they're going on what they're learning right now from each other. And they're not getting the right message right now.
Right, because if they don't talk to their parents about, because sometimes parents are still old school where they don't talk about certain topics. It's like taboo. Well, then their friends will tell them.
Oh yeah.
And then of course the friends have bad info.
Right.
Well, that's what we tell them too, Lisa. Is it's not the drug dealer on the corner that's getting kids hooked.
Right.
It's your best friends.
Right.
It's people you trust and that you join in.
That's where you got to be more of a leader than a follower. And that's what a lot of kids don't understand, because they want to fit in. So they tend to want to follow everybody instead of jumping out of the group going, "No, I'm not doing that." Because then, we don't want to be your friend because you don't do this, this, and this.
Exactly. When we, after the presentation is done and as people come up, I was very surprised, like the first time we sat outside and as the kids were coming out, this one would say, "Yeah, I just lost my mom a year ago. I just lost my brother last month. I just," and it's like a slap in the face. There's an epidemic going on. Every time you read the paper, it's like, they're saying, "Oh, heroin's making a comeback." Heroin is never going away.
Never left. No.
But now it's like, people talk. That's like after I lost Brianna. As I opened my mouth, people were coming out of the woodwork. It's like, so I feel like I'm the voice. I need to do this.
Yeah, because they've gone through the stages of the drugs, and that's probably why when they came up with crack and meth, they probably figured heroin was, everybody's doing crack and meth, but then heroin is still there because it's cheap, and and when I watch Intervention and I watch Drugs Inc. and they show like how everybody's doing it and everything, and I'm always amazed because I can't stick a needle in my arm. I'm just too much of a wuss. I would be the world's worst junkie.
Well, and that's another thing. I always make it a point when we have when there's a patient that comes into the treatment center and they've been identified as a heroin addict and they're an IV user, I'll make it a point to ask them a few questions. And one of the questions I ask them is, when did you start IVing, and how did you do it? And it almost every single time it is a friend that stuck them the first time.
See,
Brianna, it was her boyfriend.
Yeah.
Oh.
Brianna,
and what kind of friend is that to put that needle in your arm?
Immunized.
Yeah. That's what I would be. Yeah, I don't like getting my blood drawn, let alone, you think I'm going to let somebody else come and poke me? Well, my doctor had to pretty much chase me around the office. It's like, no. I don't understand it. But that's one of the things that I guess we just have to continually focus on and tell the kids about, because, like you say, every day is another one getting strung out on something. And then you see them taking the pills and crushing them up and snorting it.
And just the kids, they're just inundated now.
Yeah.
I mean, I tell people, I mean, if I was an addict like I was, in the days that, in the years that I was, now, I wouldn't have made it. I mean,
I
wouldn't have. I give these kids so much, credit for a lot of the things they're going through, but they're inundated. I mean, when we look at statistics like monitoring the futures, they go into about 600 high schools throughout the country every year. It's done through University of Michigan and SAMHSA at the national level, and they ask the 8th, 10th, and 12th graders questions. They look at perception of risk, and they look at using patterns. And what we're seeing right now is the risk perception is always a leading indicator of what we're going to see in the future. And the risk perception is based on what they feel about these drugs. And I mean, right now, marijuana use is higher than cigarette use amongst 12th graders. We're seeing marijuana being used as the first drug,
right,
other than alcohol. It used to be alcohol all the time. Now it's marijuana. And then you're seeing the perception of risk is so low amongst these kids that it's ridiculous.
They think marijuana is not a drug.
Well, they think, this is God's gift to us, right? Right? It's natural.
Yeah.
You know what? There's nothing natural about the marijuana that's out there nowadays. It's engineered.
Yeah.
I mean, you got hydroponic shops, sprouting up. It used to be a bank on every corner or a gas station. Now it's a hydroponic store.
Yeah, it's two right up the corner from me.
And come test your soil. Yeah, we'll tell you. No, there's nothing natural about the marijuana that's out there right now.
Well, what I don't like, the fact that there is medical marijuana, because those shops popped up, and who's to say that, the people that's going in with their script and getting their medical marijuana is not selling it, because that's the good stuff. They go in there and they get it, it's prescribed, and now, you can sell some of that off to whoever. I see young boys walking up the street all the time with cigarettes. I know they're not smoking cigarettes. Everybody got them little Black and Mild things that they...
they got their blunts. They got now they got their vaporizers. I mean, it's ridiculous. I had a father call me the other day, and his son was using a vaporizer to smoke the marijuana because it doesn't smell.
That is so ingenious.
I mean, I can't tell you, the efforts that are put in, that these kids put in, and the creativity. And I mean, I look at a lot of the addicts today. I mean, they are some of the smartest, gifted people out there.
They could be
if
using
they just
that
direct
for something
their way.
else. For something else.
Yeah.
I don't get it, but I'm old school, like they said. I don't know anything. I only been on this earth 60 years, and I don't know a thing.
When we were growing up, it was so easy to have anybody at the corner store here get us something to drink. Now they've cracked down on that.
It depends on what store. If you go to some of those little party stores, they'll still do it.
Oh yeah.
All you gotta do is stand outside long enough, and somebody walking by, hey man, go and buy me a pack of cigarettes. And I've seen them do it. I'm sitting in my car, and all these kids, waiting to go to school, and they stand. I'm like, what they waiting on? Next thing I know, one of them come out the store. He got a pack of cigarettes, and he's giving everybody one.
Yeah. Well, talking about alcohol sales in this state, in the state of Michigan, 17% of all alcohol sales are illegal and made to underage kids in this state.
Yeah.
17% of all alcohol sales.
And that's a lot, especially for little young kids.
But it's the exposure, and then now the big stat that we're starting to see is because of going back to the prescription drugs, is the kids that are born, the newborns that are born dependent on opiates.
So they come in shivering and sing.
And
that's not right. They should just take all the kids. Whenever that happened, they should just automatically take them and then neuter them. Spade or neuter them. Whatever they do to spade or neuter them, because you don't get to bring another one in like that to have them suffer. So anyways, tell us about, let everybody know when this event is and where it's going to be.
Yeah, well, with the Lundholm shows, we bring in Mark Lundholm. This is the second year we've done it. We're looking to do it annually, and what we try to do is we do it over a 3-day period. And Mark has always asked, if I do this, what's called a residency gig, it's a three-day event, and we do 6 shows. 3 are for the public, and then 1, like last year we went into the prison. This year we're going to go into the county jail. We do a treatment center, and then we do a high school. Last year we did Bendel and Bentley. This year we're going to go down in Wayne County and do Northville High School. And it's just, in the public programs are going to be, one's going to be in Dearborn, one's going to be in Troy, and one's going to be in Heartland. And this is going to be Thursday, Friday, and Saturday, the 5th, 6th, and 7th of December. And
Wow.
it's just, it's amazing. If I could tell you, last year we went into the prison, and it was eye-opening for me because, you go through what's called the bubble, and that's where, you're frisked and you have to take off your shoes and,
Look on your mouth and stuff.
Oh, yeah, and you're looking at these kids coming in to visit their fathers.
Right.
And, this is normal for these kids. This is what they grow up. This is how they see their father.
Yeah.
So, during the presentation, one of Mark's things is, he asked the prisoners, how many of you, how many kids do you have? And on average, they had about 4 kids. How many different mothers, do these kids have?
4.
And, 4. How can you be the father that you didn't have?
Right.
But, it's trying to break the cycle.
Yeah, yeah.
It's trying to break the cycle.
And that's what I see too when I see them with, like 5, 6 kids and that many baby mamas. It's like, I don't understand it because I just think of the kid. Each father treat their kid differently, and they all in one home. So this father come in, he's really good. He's buying his kid everything.
Yeah,
you got 3 over here, like, where mine at? Then here comes another daddy, I don't have any money. I can't do birthday, whatever. I can't do Christmas. I mean, it's sad. It's sad.
Yeah, that dynamic is just, it's just amazing, the different dynamics that these kids are growing up in.
So this event at the Harlan Performing and Arts Center is actually in Howell.
Yeah, it's right, it's right on the border. It's right at 50, it's right at 23 and 59.
Going into Brighton.
Going into Howell. It's west of 23 on 59.
Yeah. I always see the sign because when I go to Brighton shopping, that little crazy turnaround.
Oh, yeah, yeah.
That thing is crazy.
The old high school.
The old high school?
Yeah.
Yeah.
That thing is crazy.
Yeah.
First time I ever hit that turnaround, I end up going back the same direction I came. I was like, what happened?
Oh, yeah, yeah. But we're it's just, it's north of 96 on 59 at the old Heartland High School. And it's, we're going to have, the doors open at 6. We have some vendors there that are going to be selling their crafts as well. And then we have a singer-songwriter called Carly Keys. She's going to be performing. She's in recovery herself.
Oh, okay.
So she'll do a few songs, and then Mark comes on. And, I went and saw him a couple weeks ago out in Kalamazoo. He was in town. And I tell you, he's funnier than ever now. He's got a show that you'll leave with a piece of him. His message is strong.
The money for this goes where? Is it a fundraiser?
Well, what we're doing it's always gauged as a fundraiser, and what we do is we try to work with as many community groups as we can to help promote the shows, and then with the proceeds that we generate. Goes back into the community groups that are identified in helping us promote these.
Oh, okay. Do you have anything you want to say, Sam?
I just wanted to give a shout out to the Community Foundation of Flint. We got a grant from them for $5,000. What that does is it allows us to go into many schools that can't afford to pay. So it can be seen. What we want to do is a lot of schools can't afford, none of the speakers, we don't get paid. So this is our only way to get in there, is if the school can pay for it, because we have to pay for the DJ, and some people, you know, can't afford to come and speak, so we will give them gas money or whatever. So that's how we're allowed to go back in there, is by fundraising and support of the community.
Right.
I tell, you know, a lot of schools that I talk to that can't afford to have us come, I tell them, look, don't let money stop you. If you want us to come, I'll come into your community and I'll go talk to all the business owners if I need to,
Right.
and collect the money that way.
And you've had good luck with that then?
Yes, we have. You know, for the first year and a half, Genesee County Sheriff Department, they got a grant, and all the Genesee County schools weren't paying anything for us to come in there. The grant had run out. Now we're out there hustling.
Always hustle.
Well, I don't want no kid not to hear this message, because you know, like I tell these kids, hey, look, I couldn't save my own, but hopefully I can save somebody else's kid.
Yeah, you can give them the resources, and you know, lead the horse, hopefully they drink.
Exactly.
Yeah. So anyways, I thank you guys for coming in today. It's been a pleasure, and talking to this madman on the phone.
If you're not doing anything Saturday night, come on out.
It's hilarious.
It'll be a lot of fun.
Yeah, thank you so much, Lesa, for having us.
So, anyways, John, we're gonna sign off now, and once again, thank you guys for coming in. And then Saturday, December 7th, from 6 to 9, Heartland Performing Arts Center, 9525 East Highland Road in Howell, Michigan. Come out and see Mr. Mark Lundholm. Laughter is no luxury. And saying that, this Flaminpit, and we're out.